According to the Expert Review of Obstetrics and Gynecology, of the approximately 750,000 teen pregnancies that occur in the U.S. annually, about 82% are unintended. Of those unintended pregnancies, about 50% are due to incorrect or inconsistent contraceptive use, about 50% are due to non-use of contraception, and only 5% are due to method failure. The U.S. has experienced a recent decline in teen pregnancies. This is due to increased use of hormonal contraception. Although failure rates are pretty low, contraception methods that require women to remember to take their medication or change an patch or return to a clinic for an injection often have higher real-world failure rates. So clinical failure rates for all contraception, not all contraception, the pill, the patch, the ring, IUDs, Implanon, etc., are about 99% effective. That means there's about a 1% clinical failure rate. The real-world failure rate for the pill, patch, and vaginal ring are about 6 to 9%. So the reason there's such a big difference is people often forget to take their medication on time, they'll forget to change their patch on time, or they'll forget to go back to the clinic. So getting something like the implant or an IUD, which requires you to change it every, 3 or 5 years. So this is a lot easier to remember than having to do something every single day. So long-acting reversible contraception like the IUD and the implant are over 20 times more effective at preventing pregnancies than the pill, patch, or ring. So it's good to know. The American College of Obstetrics and Gynecology recommends long-acting reversible contraception as a first-line contraceptive method for all women, regardless of age. So it's including teens. Their benefits generally outweigh their risks in teens. IUDs are a category 2, which means the benefits generally outweigh the risks. The implant is classified as a category 1, which there is no restriction for the use of this method, which means the benefits almost always outweigh the risks, regardless of your age. Generally the more risky of implant and IUD is the IUD. This is because pelvic inflammatory disease risk is elevated in the first 20 days of insertion. That's probably because of the surgery itself. So this should not deter people from getting an IUD. It's simply something to consider. People experience varying levels of discomfort from insertion. Generally, you should get an STI screening the same day as you get an IUD, you should get the STI screening before you get the IUD, and that way if you have something, you can get it treated first, and then you get the IUD inserted. Otherwise, you do have an increased risk of pelvic inflammatory disease, which is not something that you want. If you do have an infection at the time you get screened, like I said, get it done first. With chlamydia or gonorrhea, the IUD does not need to be removed if it's already been implanted, but you'll need to start with antibiotic therapy while the IUD is in place. Let's see. Just a note, long-acting reversible contraception, that's the pill, the ring, the patch, the implant, or the IUD, does not prevent STI transmission, so you should practice dual method contraception, like condom, to prevent STIs. This recommendation holds true for non-long-acting reversible contraception, so always use condom. Thank you for listening, and if you're wondering where to get more information, go to the Expert Review of Obstetrics and Gynecology for more info on the safest and most effective birth control. Thanks for listening, and be safe.